So if I don't get my wisdom teeth removed, what's going to happen? Hi, this is Dr. Daniel Choi with North Texas Dental Surgery here, and I wanted to go over a very common question that I hear. And patients sometimes ask me, okay, so if I don't get my wisdom teeth removed, what's going to happen, right? And so I want to preface this by saying, I'm not saying that any of these potential complications will absolutely happen at some point in your life. I'm just saying that there is a possibility of what could happen. So again, I see a lot of patients that might be age range from, we take out their wisdom teeth, age ranges from 12 years old, typically for orthodontic reasons, all the way to 85-year-olds who have pain with their wisdom teeth. That's the oldest I've ever seen. But this may be, the symptoms that a patient may be experiencing at some point in their life may be a reason as to why they need to get their wisdom teeth removed. So, again, very importantly, saying that this is not a certainty to happen at some point in their life, but that there definitely is a possibility that these symptoms could arise later on in life, and that's why you definitely are better off trying to remove your wisdom teeth earlier in life. And again, we'd like to stress getting your wisdom teeth out earlier in life because the procedure is a lot easier because the bone is softer, less chances of complications, etc. So what are some of these complications? So I like to say, crowding, right? So a common complaint that I have heard from patients are that my teeth used to be straight. I had ortho in my teen years and never had my wisdom teeth removed, and now my teeth are all crooked up front. And so that's a common reason why, to me, and a lot of patients have seen that frustration, that it's definitely better and a good idea to get your wisdom teeth removed, whether before heading into ortho or even after ortho. So one of our, being the surgeons and going in there and removing the wisdom teeth and sometimes dealing with the extremely crowded wisdom teeth, highly impacted teeth, sometimes we do get a little frustrated and we wish that orthodontists, being the front line, and when they see those patients after ortho, if they would definitely recommend those patients to get their wisdom teeth removed. Patients typically being teenagers at that time it's just such an easier procedure, both for the patient and actually for the surgeon. So that's one driving frustration that I know that typically surgeons have in regards to removing wisdom teeth. We really wish that there would be more of an emphasis given to teenagers to remove their wisdom teeth. And that being because we do see a lot of patients who come in remorseful. They're in their 20s or their 30s, and they always say, man, I really wish I had gotten my wisdom teeth removed when I was a teenager. And typically, something that we might also hear in relationship to that has to do with finances, because a lot of these teenagers during that time have parents who actually have dental insurance, and they could have really utilized that dental insurance and have to only pay several $100s for a dental insurance copay to get all 4 wisdom teeth removed and the IV sedation. But unfortunately, when people in their 20s or 30s are off their parents' dental insurance, or might not have their own dental insurance through work at that time later on, that procedure can end up being several thousands of dollars. So that's one issue, again, the crowding. So another issue is why do people typically come in for some complication you might experience at some point in your life is pain from the cavities, right? So with wisdom teeth being very far back in your jaws, cavities are caused by bacteria, right? So we have different types of bacteria in your mouth, and special groups of them can actually cause cavities. And so with it being so difficult to clean in certain areas of the mouth, with your teeth being impacted, gums overgrown or partially overgrown over your wisdom teeth, it's very difficult to keep clean. So those cavities can not only affect the wisdom teeth, but can actually cause large cavities on your second molars too. And so we've seen cases like this that get as far as where the cavities are so extreme that we actually have to remove both the wisdom teeth and the second molars. So again, the pain associated with the cavities. Another thing that we see also is the pain that's associated with your gums, right? So periodontal issues, meaning gum issues, right? So sometimes we see, again, partially erupted or full bony impactions where we see a little bit of the tooth or maybe not any of it at all. The bacteria sneaks in underneath here and over the years starts causing bone issues and gum issues, and that can really translate to a lot of pain. So at some point in your life, you might develop these issues. Again, we've seen patients in their 30s, 40s, 50s developing this pain. So, again, not saying that any of these issues are absolutely likely to happen to you. Again, we see plenty of patients in their 50s or 60s who said that I've never had any wisdom teeth pain in my whole life, and I've had them my whole life, right? So, we definitely see cases like that, but again, we do also see plenty of cases where one of these aforementioned issues can develop, right? And the final thing I also wanted to talk to you about was cysts. So a cyst, what is that? So basically, sometimes associated with your wisdom teeth, you can develop what we call dentigerous cysts, where basically a cyst can develop around the wisdom tooth area. And I've even seen certain cases where there's extreme bone loss caused in the jaw that can even lead to jaw fracture. Okay, so that's definitely something that, if you have regular dental appointments, then your dentist would definitely see something like that developing. So we definitely do see some dentigerous cysts developing here and there when our patients are getting their wisdom teeth removed. So again, not saying that any of these complications or these symptoms are absolutely going to happen if you don't get your wisdom teeth, but just giving patients a general idea of what could happen. So I like to use this example. This is actually a patient who will be coming in a few days from now to get his wisdom teeth removed. He's actually 29 years old, and I can't exactly remember, because his consultation was a few weeks ago, what exactly was his pain, but I do believe that they were coming from his bottom teeth. But what we always recommend in cases like this is to get all 4 of his wisdom teeth removed, and there's certain things that we look at in relationship to basically what his, how old he is, what his bone density is like, his root formation, and also the proximity to nerves, right? And so these are certain things that we look at. And again, this is a 29-year-old who's never experienced wisdom teeth pain, and suddenly he's starting to develop these issues. So, I'd like to tell patients that it's also very important to really get these addressed, again, when you're a teenager, because it just makes the overall experience just so much better. The bone is softer. The procedure is going to just be a lot easier for the patient, and just a less chance of complications. So again, just these are some factors that a patient can later experience when not having their wisdom teeth removed.